So my purpose for today will be to address any concerns you may have and explain the new medication Calumet. So before we dive into that, can I just verify that the information we have on you is correct? So do you have any drug allergies?
No.
No drug allergies?
Not
Okay.
at all.
So are you taking any over-the-counter or herbal or supplements?
No.
Okay. And do you have any medical conditions?
Conditions. Okay. I have kidney disease.
Kidney disease?
Yeah,
Okay.
recently I got a gout flare.
You got a gout flare. Okay. So have you been experiencing swelling or inflammation lately?
Sorry?
In regards to your gout, have you been experiencing swelling or inflammation?
Could you explain to me?
Have you been experiencing any swelling or inflammation?
Let's just go on.
Okay. So I'd like to understand your daily routine. What's your lifestyle like? What do you normally do for fun?
I don't have fun
You don't have fun? Why is that?
because I need to work.
You need to work.
40
Okay.
hours a day.
Oh wow. Okay, that must be a lot to handle. Okay. How are you feeling about taking this many medications?
I don't have any discomfort, so I'm confused.
You're confused. I see.
Yeah, why do I need to take so many drugs?
Okay. So, oftentimes, your medical conditions like high blood pressure, diabetes, and kidney disease, they're often very silent, but your labs actually prove otherwise. So you have an elevated uric acid level, and as well as your potassium levels, they're also on like the higher side. So, I think it's the fact that you're not feeling any discomfort is a sign that the medications are working. Do you ever forget to take your medication?
Yes.
You do? Okay. Did you take it yesterday?
I think.
You think so? Okay. Well, actually, all these medications are helping you, such as valsartan and carvedil. It's helped to lower your blood pressure and then overall to protect your kidney. And febric and colchicine here is also to prevent any gouts that you may have. So, did you understand all of that so far?
Yes.
Okay, great. So let's dive into Calumet. So it is a calcium pulse-free sulfonate. So it is to treat your hyperglycemia. So that is to treat high levels of potassium in your blood. So it removes the extra potassium and then it brings your blood levels down to normal so your kidneys can function correctly. And it is a powder, so you would mix 30 to 50 milliliters of water or syrup and put into a cup, and then 30 to 50 milliliters of water, and then stir it. So once the powder dissolves, you can take it. And you can take it with water or syrup. And I don't recommend it with orange juice. And because that has it's dangerous for your condition since it has potassium levels. But you can take it. I would advise you to take it after dinner, since it says here that you have a lot of drugs that you need to take twice daily or in the mornings. So you can take it after dinner, preferably 1 hour after dinner. And did your doctor explain any side effects that you may have with this drug? No? Okay, so if you experience diarrhea, nausea, or vomiting, that should all be normal. However, if you experience unusual bleeding, and abdominal pain, seizures, I advise you to seek medical attention immediately. And if you miss a dose, you can take it as soon as possible, but if it's time to take you can skip it if it's too late to take your dose, and just don't double dose and just get back to your regular dosing schedule next time. And store it in room temperature away from sunlight and children. So, what is your diet like?
Actually,
fast food. So it's very okay. So mostly processed foods, I'm assuming, like hamburgers or. Oh, okay. Okay, I see. Well, I recommend you eat low fat, whole grain foods, and more towards lean protein, chicken and tofu. But I think we can just start by taking meals on a regular basis, and then we can go more into the specifics. And you mentioned you don't get any exercise in, right? So I would also recommend that you maybe take walks, like 15 to 20 minutes, which will be a good start, so that can help control your body temperature, blood sugar, and your blood pressure, as well as your weight. Yeah, and like your fluid intake is really important as well. So do you drink water on a regular basis, or how much water are we looking at? You don't drink much water? Okay. Are you feeling fatigued because of all these drugs, you think? Okay. Well, don't stop taking the drugs, because your body might react and your kidney might react in a way that we won't want, and that'll put your heart at risk. So please make sure to take these drugs accordingly. And do you have any concerns that you may have?
Just want to know how to prevent from
How to prevent?
It's getting worse.
Right, yeah, I can see that, yes, it is, right? So I think we can start by lowering your blood sugar, and we can go into modify our lifestyle, such as eating more healthier food and exercising, and maybe try to socialize with your friends as well, so that'll make you in a good mood. And how is your sleep? What is your sleep like?
I sleep well.
You sleep well?
Yeah.
Okay, so to summarize, so you'll be taking Galimate once a day, preferably after dinner, and the dosage. Yeah, Galimate. Do you remember? Okay, yeah, Galimate, and you mix with 30 to 50 milligrams of water or syrup. And side effects such as diarrhea, nausea, vomiting is normal, but if it's you have to seek attention if you have unusual bleeding or seizures. So we've gone over a lot of medications. So do you feel comfortable just repeating back to me in your own words on how to take this medication? Oh, you don't. Could you? Okay, that's okay. Could you just tell me how you would take this medication?
I'm not sure.
Okay, just remember to take it after meals, 1 hour after meals, and it is a powder solution, so you have to mix it with water. And you're doing a really good job managing so many of your conditions, and I really praise you for that. And if you have any questions, you can call us, and we'll be happy to help. And do you have any other questions or concerns you may have for me?
No.
Okay, thank you. I appreciate you for your time.
Okay.